video next week that it shows that same sort of scenario playing out. Okay? Well, good question. So again, one of the risks, lack of movement. If labor keeps going because we're moving around a lot, and all of a sudden we're not moving, things can really slow down. So again, it can slow down labor in that way you can't move. You don't always get the urge to push once you're complete. Now, our anesthesiologists are doing better and better at getting people to, the right dose so that they can still feel stuff, but you don't feel that urge, that guttural primal urge to push that people say that's what gets the baby out. Now, I had a brilliant experience this summer. I wasn't brilliant, but Dr. Peterson was, and we had a client who she got an epidural because she was having extreme back labor, and I think emotionally she's having some hard times. And so we hung out after the epidural. She rested a little bit. She was finally then 10 centimeters dilated, and she was getting ready to push. Now she pushed for probably 2 hours, and not much was happening. And you could see that. You could see I can see an effective push. Nurses can see it. Doctors can see it. You guys don't know what it looks like. So and I can give you all the feedback in the world, but if you can't feel what's going on down there, it's really hard to know if you're doing it right. So Dr. Peterson had the idea of turning off the epidural, and I'm like, I've always wondered, can you turn off the epidural to have for the pushing stage? You use the epidural for the really hard transition part, and then turn it off for the pushing. And so Dr. Peterson and the patient agreed that it would be better, because if this patient wasn't getting this baby out fairly soon, we were probably going to have to get it out a different way. So epidural got turned off. Slowly you could see her her contractions, her response were still the same. It was still good solid pushing, but she could feel what she was doing. And within about 45 minutes, she had pushed that baby into a place where we knew it was going to be a vaginal delivery. And I wasn't so sure about it for a while. And I asked Dr. Peterson, why doesn't this happen all the time? And she said a lot of doctors think it's cruel to relieve the pain and then to bring it back for the pushing. But it's a different kind of pain. It's a different kind of contraction for the pushing. So I'm totally in favor. If it seems like something you guys can do, I would see if you can advocate for that. And maybe that would be a good thing to put on your birth plan. Is if we have an epidural, can we have the option to have it turned off for pushing? Because some doctors might not be okay with that. All right, or you might not want to do that. You might not want to feel it. Okay, but I think that if you're looking at 2 hours in and you're not real effectively pushing, and everyone in the room can see that, maybe the epidural needs to be turned off. Okay. So again, you can't pee. So you have a catheter, so it's one more tube. And it can slow down labor. Again, if it gets you so relaxed and you're so in the groove, and I forget I'm even in labor because I'm not feeling the pain, then you might need to, then they're talking about Pitocin at that point. Because or you can have the epidural turned off so that you remember that you're back in labor. So it can slow down labor. It can drop your blood pressure, and you have to wear a cuff almost all the time. Again, you have to turn side to side. Afterwards, after it's taken out, you can get a spinal headache. About 1 in, and I'm on the back page now. So sometimes spinal fluid leaks out of the epidural hole and causes a headache within 24 hours of removal of the epidural tube. And it can be an excruciating headache, and that is not the way you want to start parenthood, okay? So the way you know it's an epidural headache is if you lie down flat on your back, it goes away, and if you sit up, it comes back. And all you need to do is tell the doctor, and they'll fix it pretty quickly with a little patch. But it's just not fun. So like I said here, it happens to about 1 in 30 women get that epidural headache, okay? So I know that when I talk to people about epidural and their biggest fears, what happens when I get paralyzed? How many women do you know walking around, or not walking, are like, I'm in a wheelchair because of my epidural? It does not happen. I can't say non-existent, but it's a non-existent risk. It just isn't. It's not. It's serious, but it's not likely. Okay. So I say low risk of permanent spinal damage. A benefit of an epidural: you can move to a cesarean section quickly. If you have to move to an emergency C-section, if you don't have already the epidural in place, you're going to get knocked out, and you're going to be down and under for the duration of that C-section and probably for the first 2 hours of your baby's birth. Now, if you got the the epidural, and you have to go to an emergency C-section, your pain relief is already there. You can be away for that emergency C-section. Okay, so that's with the client that I had this summer, the one who got the epidural turned off, there was a couple of pretty hectic moments that she was thinking that she'd have to go into an emergency C-section because the baby's heart rate was dropping. And she even, when we talked about getting the epidural, I said, I think that's okay because you've already been really vulnerable to an emergency C-section. That could come up again. And you could either be awake and aware with an epidural for it, or you can be knocked out. It was just, her risk of having an emergency C-section was elevated because of the way she came in. So it made sense for her to get an epidural and to keep going that route rather than try to do it unmedicated and then have an emergency C-section and not get to experience that and have to deal with that, okay? So that's a benefit to an epidural. Again, I say that it doesn't pass through the placenta, but again, research does suggest that the longer you have the epidural, inevitably the baby gets some of the medication. Melina, do you have a question?
Yeah, about the C-section. My cousin just had a baby last week. She was doing it naturally and then the baby was stressed enough where they did a C-section. And I think, I'd have to ask her, but I think they did the spinal block.
Did they?
So she didn't have the epidural.
She didn't have the epidural still, and that's, I doubt it was an emergency. Yeah. The way, when I had my baby, the first one, I had enough time to get the spinal block, so that I could be awake and alert. It was like, yes, you're gonna get a C-section, here's the procedure, here's how it's gonna go, we're gonna do a spinal block, then I was moved to the cesarean. An emergency is like, we gotta get this baby out in 5 minutes or less. And so there is no time for a spinal block at that point. Yeah. So she did not have an.
So maybe it wasn't an emergency.
I don't.
But it was an unplanned C-section.
Yes, exactly. It was probably not an emergency. Emergency.
Yeah.
Like.
Sure.
Sometimes happens.
Yeah.
So, but don't go tell her that. This is her story. She obviously needs to hold on to that. Any other questions about that? Okay. So the benefits are predictable pain relief for the most part. Like I said, sometimes it doesn't work. Sometimes it only works on one side, but that's rare. So it is predictable pain relief, and it is relief. I mean, it is pretty amazing the change of the room that happens. And again, I wrote that it can be turned off to feel when you feel the urge. Now, I have my other little lecture here, and it is a relief. And as a doula, being in the labor and delivery room when someone is not getting an epidural, it's intense, it's long, it takes a lot of energy, and it's a lot of work. All of those things are why it's called labor. And I'm just talking about for me, and for dads. And that's not even for mom. So when you get an epidural, it changes the whole tenor and tone of the room to quiet, and the nurses come down and they turn off the light. And I really think some nurses love it when women get an epidural. They turn off the lights, they say it's time for you to go to sleep and all that stuff. It just changes it and makes everyone's job a lot easier. But here's my thought. We just drive our car where we need to go, and we show up at work, and we do what we need to do through the day, and we're kind of on automatic pilot all the time. Now, on your baby's birth date, the day that your baby is picking, hopefully, to be born and to enter this world, you do not need to numb that. You do not need to put anything on automatic pilot. And it's okay to feel that intense pain that comes with the contractions, or the intensity, or the struggle and the exhaustion with labor. So if you cannot numb it for one day, because this is a day, I still tell my kids' birthdays when I call for insurance or whatever, this is that day for you, and this is that day for your baby. So if you cannot numb it for 24 hours and not put it on automatic pilot, I think that's an okay thing, because this is a natural process that happens, and if it's happening the way it's supposed to happen, then it's all good, and you can handle the pain. Every person in here can handle the pain. And I really feel strongly that an epidural for the pain is different than an epidural for exhaustion. To me, I've seen mamas who cannot push out their babies because they're so tired, and they need an epidural to get some sleep. Now, if you can push out your baby because it hurts, that's okay. Don't get an epidural because of the pain. Get an epidural because you're exhausted. Exhaustion is a medical condition, pain is not. Pain during childbirth is not. Okay, so if you are needing to sleep for 5 hours so that you can push that baby out, that's an okay reason to get an epidural. If you just can't handle the pain anymore because you don't have the coping strategies and you're forgetting everything from class, dig deeper and see if you can find some coping strategies, or your partner or your doula. So that's my first little spiel. And my second is that, well, I have two more actually. My second is that you get relief, but your baby doesn't. So you're going through this in tandem. And your baby it's hard for the babies to be born. And I mean, how could it not be? I'm just guessing, but how could it not be? And so if you get an epidural and the baby doesn't get any pain relief, it kind of breaks that contract, that tandem that you guys have. And so I think if you are on the fence about getting an epidural, like some of you said you were, I think you can consider and say, I'm doing this with my baby. This is normal pain. I'm okay with this pain. We are doing this together. This is our contract. And again, if you're exhausted and it's a medical condition, you need to get an epidural because you need to get that baby out and you need to be awake and able to push it out 5 hours later. But if it's just because you've been in labor for 4 hours and it's getting really, 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 really hard, try it. And just think about bringing it back to that relationship that you have with that child, okay? And my third little spiel with this, so I used to live at the top of Burgess Creek Road, which is a really big hill. And I would sometimes ride my bike down to work, and then, of course, it was at the end of the day, I'd have to ride my bike back up. And when I was riding back up, it was hard, of course. It's a really, really big hill. It's really hot. It's 4 o'clock in the afternoon on a summer day. And so I'd toy with myself with getting off the bike and pushing it. But you know what I really discovered is that getting off the bike and pushing it is no easier than just staying on and pedaling. And anyone who rides a bike, and I don't ride a bike, but I've ridden bikes,